Time now for the global outlook. An Ebola outbreak in coastal West Africa has claimed the lives of 111 people. And just yesterday, the World Health Organization said that number could rise as it expects the outbreak to continue for several more months. For a look at the global response to an epidemic like this, we're joined by Bloomberg contributing editor and former White House security advisor, Richard Falkenrath. And Richard, when you were at the White House, in fact, you worked on responses to exotic diseases like this, an outbreak. So far, how do we contain something like this?
Well, it depends a lot on the virus, and in this case, the virus is transmitted only by close fluid contact, and so that helps a lot. This one is not transmitted through the air very easily. So the key here is to identify the treated people, the infected people, and isolate them so that it doesn't spread. If that's done successfully and standard infection control procedures are put in place, then the outbreak will eventually burn itself out.
And do we have a proper procedure in place to deal with something like this?
Well, it's up to the country that's infected, in this case Guinea. It's the first time Ebola has ever been in Western Africa where it is now, and they're struggling with it. It's gotten into the urban area. Previous outbreaks have been predominantly in rural areas where there was greater distance between communities, and now here in the urban area, it's very difficult. Some of the neighboring countries have closed their borders. Senegal and Liberia have already enacted measures. It hasn't spread abroad yet, and there's no indication that it necessarily will.
Right. Okay, but isn't there a process in place with the CDC, the World Health Organization, with them coming in and trying to contain this as well?
Exactly. They are, and they're there on the ground trying to assist us and contain it. The WHO, the World Health Organization, came out with a statement yesterday that was fairly alarming with some new data, but they're there to make sure that the people who are infected are properly isolated and there is no transmission from them. In these rural communities, one of the ways this virus spreads is because of the caregivers for someone who's sick. Usually they will go to their home and the family members will take care of them. They will then get the virus and it will spread that way. So what these doctors do is they isolate the patients and they treat them in a medically sound way.
Richard, speaking about another hotspot, though, that is going on around the world, you know about, of course, obviously Russia and Crimea. You've been watching that very closely. We had Senator John McCain on, actually, this morning, we did a follow-up with him on his testy exchange with the Secretary of State, John Kerry, where he criticized the foreign policy agenda and said that the U.S. is not doing enough. And I want to play for you part of what he said about that.
If Russia moves into eastern Ukraine, they will fight, and they should fight. And we won't even give them defensive weapons. Look at these actual sanctions that have been enacted on Russia. As they're minuscule. They're minuscule, and by the way, they won't get any worse because the Europeans will not do anything more stringent because of the energy situation.
Is McCain right here?
Yeah, I mean, he has a very strong point that the international community has very little leverage over Vladimir Putin in this context, and the Obama administration has not led particularly decisively. The international community is also divided between the United States, which sort of talks a big game, and the Europeans, who have to live with this problem, are more economically dependent on gas supplies from Russia.
Yeah.
So I think Senator McCain is expressing a critique widely believed in the U.S. foreign policy community that the Obama administration has not done particularly well with the Ukraine crisis.
That they're being too weak about this. All right, Richard, thank you so much for joining us.